Hello, I'm Vandana from Systems Genomics Lab at Manipal University, Jaipur, under the supervision of Professors Prashant and Survachkala. I'm presenting our ongoing research titled Study on Anorectal Malformations of Newborn. This work focuses on identifying genetic variants in syndromic and non-syndromic forms of anorectal malformations using next-generation sequencing and genomic tools. ARMs are congenital anomalies resulting from abnormal development of the hindgut, affecting the structure of the anus and rectum. Globally, ARMs are estimated to occur in about 1 in 5,000 live births. In India, they form a significant burden, accounting for about 15% of pediatric surgical admissions. A particularly rare and region-specific form, the congenital pouch colon, is seen predominantly in North India, where it represents around 6 to 13% of ARM cases, and notably over 90% of all the CPC cases reported worldwide originate from this region, making it a critical population to study. To categorize these malformations, we have referred to multiple classification systems. The early Gross and Bill system described ARM types based on their level relative to the pelvic floor muscles. This was followed by the Wingspread classification, which grouped them into high, intermediate, and low types. Wiener classification brought a gender-based anatomical approach, and the most widely used was the Krickenberg classification, which helps to standardize clinical reporting and outcome studies. Our poster also features an image showing different ARM subtypes, which helps visualizing the wide spectrum of phenotypic variations we deal with clinically. Surgical management is tailored according to the type and severity of the malformation. A colostomy is often first step in managing complex cases, providing fecal diversion and preventing infection. Definitive repairs are performed using techniques like posterior sagittal anorectoplasty for better anatomical access. Laparoscopically assisted anorectal pull-through in high lesions for minimal invasions, and anterior sagittal anorectoplasty in female patients with perineal or vestibular fistulas. These surgical procedures are standard of care and do not interfere with our research workflow. Our methodologies involved recruiting patients from pediatric surgery departments, collecting detailed phenotype and family history, and obtaining the blood and tissue samples. Tissue samples during the surgery from the patient, and blood samples from the parents and unaffected siblings. The samples are then sequenced, and the variants are analyzed and validated using bioinformatics pipelines like the convex and then Sanger sequencing. So far, we have identified variants in few interesting genes, including the JGB2 and CCD-C50, GUCY2C, and FREM1. These findings are currently being validated and correlated with patient phenotypes. Looking ahead, we aim to expand our cohort, explore the functional impact of these variants, and contribute towards building a genotype-phenotype framework specific to syndromic ARM cases in Indian population. Thank you.